Is that dinner? Dinner? Sige lang, basta I told you, I totally understand. I can allow you to eat. Basta you just keep quiet. Just keep your composure lang yun. Anyway, we have a very long topic this evening, but at least di mo mag-septic shock ba? Sige mo ka-shock man. Okay, before I have to proceed with that, what I mentioned to you na very long, at least over here na I can see all of you and like there na we were doing like hide and seek. Okay, you were trying to hide from me, ambot lang. Okay, as a prayer, I need to tell you this because I'm quite disturbed, no? So this was your first result. This one is the highest score, this color. So the highest score trend is consistent, diba? So does the takers. It's just the passers. Hindi consistent. Oh, you look into the first assessment. The passers for the first assessment was this one, 54. Pila lang malika percent if you think about that. So block exam, there were only 5 of you who actually passed. And I was thinking, probably it was because of time constraints. Tama no? I wasn't even expecting to proctor you. I was thinking na the exam would be held for the graduation. So I was not able to go to the parlor and fix my hair and everything. Because I tried to be there and knowing that the exam was actually given. And you only had 9 plus and it was ended at 12:45. Sige lang. So if you have to consider that probably you have given more time to the other subjects, not to this one thing. It's very easy, Romani. LMJ, good. May ilangan sa score, masayot na. Anyway, I've been trying my best to reduce the lowest term, our terms. And you try to be, resuscitated. Then the one girl, not good enough. No, I'm looking forward on the next assessment that will be on Monday. When fully recovered from resuscitation. We'll be talking about the dinner, no? Please don't give up easily, huh? Okay, so this girl. What was that thing that we did last time? No, it was I was actually thinking that this actually inspired them, no? Asar ako. Anyway, we are still to talk about death. next meeting would be the last time that we're to talk about death, but I cannot really promise you that it would be the last time that we we'll talk about death things, because as I have mentioned to you in my time, no, it was like 70% we were talking about death rather. So in your time, so as not to be so ba, in a monotonous situation wherein we just have to talk all the time about death, but then we cannot help that they are to be incorporated in some other topics like injuries. Nalagyan ka po ng death. Anyway, truth mo yun ng death. So, this time we're to talk about the medical legal investigation of death. Why is it so high, Rayo? Okay, so for the medical legal investigation, the first one is the crime scene investigation. So do not bother your brains thinking what actually happened. Besides the crime scene, what actually took place there, the essential ingredients of the particular criminal act which was done. There could probably be articles of good value which will lead to the development of the process or the investigation. Remember those corpus delicti, tracing evidences, and all those things. You could actually get it here. So we cannot say that we just go directly to the victim if the victim was already thrown into the seas, no? When he was actually killed on this side. So you can see a lot of things here at the crime scene. So the second part there is the autopsy. So we shall then be talking about autopsy. And I would like to tell you what differs from that of post-mortem examination. This post-mortem examination could be incorporated into the autopsy, but it's just that it only involves external examination. No incision is done. Okay, so persons to give consent. So, in some movies na punta, it doesn't mean that if one person is very much interested, what could probably kill this person, it doesn't mean to say that he can actually do that. He can actually consent to this. So there are people, the rightful persons, to give the consent, and they are to be in this particular arrangement. So if the victim is married, I do not know if how many of us here are married. Legally married, I mean. Legally married. In a lawful wedlock. Wala. Wala. So, young, free, and single mo ha. Couple pero not legally married. How na, John? Where is he? I'm thinking, my God, that they are to be seated close with Yuma. Okay. So it has to be the spouse. So do not forget that there is a wife or the husband. So do not immediately go to the brothers and sisters. But in fact, you know that as to the hierarchical arrangement, it has to be the spouse first. Okay, so before moving further, I would just like to clarify that with you. What have you understood with the word descendant? Who are those people who could be considered as descendants? Anak? Anak, offspring. I'm just translating it. Children, grandchildren, going down pa. Descendants, ascendants, parents, grandparents, great-grandparents, great-great-great-grandparents. bahala na. And then, that's the time pa na brothers and sisters. So do not go immediately to the brothers and sisters. After all, for so many cases, they are the ones who are very interested with the case, no? Brothers and sisters. So in case of descendants, diba, you know na, it has been reviewed na who are those we consider as descendants. So descendants of the same degree, for example, descendants, so son and daughter. Son and daughter, for example, the oldest shall be preferred. Okay, so it has to be like that, so the seniority. Ascendants, paternal shall have the better right. I'm not the author of this one, ha? So don't question me. Ha? Namatay na? Divorce? Okay, so that will make the case very difficult. So after all, this one is just for the clinical autopsy. Okay, so it's clinical, so this one is what we call as voluntary autopsy. The autopsy that we have known is that kind of autopsy which is done by authorities. So no need to ask the nearest kin, no need to ask for these people. This is just for the clinical. Okay, so as we are still talking about death, think about that the body will start to decay after 24 hours. Do not question me this time, ha? Burial is not necessarily a public health requirement. It was advised by WHO that only curbs carrying infectious diseases strictly require burial, but you will know more of that. So the general rule of thumb for the rate of decomposition is 1 week in open air, 2 weeks in water, 8 weeks underground. On my part, I could just imagine this while I would be riding the ocean jet. No, open air, 1 week, 2 weeks water, and 8 weeks underground. It would just be like that, no? Okay, so we will be talking about PD 856, that's section 90, going to, it's actually up to 100 something, but it's about embalming processes, so we don't have to talk about that now, unless you are very much interested. No? You can actually have it on your own, so we'll just be focused with, as for doctors, or things which are of our concern. So let's talk about burial grounds requirements. So it's very easy for you to study. If I give you this, I hope it will help. Oh, they are already highlighted. Ground shall be 25 meters distant from any dwelling house, and no house shall be constructed within the same distance from any burial ground. Sa Atuang countryside, have you noticed that there are still houses close to the cemetery? No. So we don't remember that. We don't think about that, or else we'll have a wrong answer if we remember it that way. So just look at the numbers which are highlighted. Another is, no burial ground shall be located within 50 meters from either side of a river, or within 50 meters from any source of water supply. We also notice that there are artesian wells close to the cemetery at Lugtan. But they are trying to explain that the water that they obtain is for the plants in the cemetery. I don't know. Basta you have to remember these figures. What else? Requirements for burial. So, any dead body cannot be buried unless there is already an issued death certificate. That's why it's very important for us doctors, now when our patient is already dead, we should be able to come up with the issuance of death certificate within 2 hours. Maybe you would probably think that there now. It's very long. What makes it long? What keeps the doctor, what makes it very long for the doctor to process. You will know later that it's not that easy to issue a death certificate. Okay, so it should be forwarded to the LCR within 48 hours after death. So if you were not able to understand this patient, that this patient already died, you have to consider those patients coming in at the emergency room and 5 minutes you already died, bad. It may actually give you a very long time thinking about what actually happened to this person. No? Alam mo, you just right there, cardiorespiratory arrest. Of course, everyone will die if that's the case. So the burial requirements, like have you heard of OFWs who died in their workplaces and they are being transported? So, you have to stick with the period of quarantine on when we are reading about the shipment and so on, so they know about that. So, grave burials are buried shall be at least 1.5 meters deep. So it should not be above this. So like it's just sa about 1 foot. Magbaho mong ganyan, dog. Anyway, about the post of burial, okay, shall be born with the nearest kin. What else? So if there is none with the nearest kin, so it will be by the city or municipal government. So if ikaw ang mayor and the dead person has no share relatives just being found at the riverbank. So there should be no prohibition on account of race, nationality, religion, or political persuasion. And so if the person who issues a death certificate has reasons to believe or suspect that the cause of death was due to violence, like they are thinking this person was killed not in a natural way or died of violent death, then the deceased shall not be buried until a permission is obtained from the provincial or city fiscal. Okay? It has to be investigated. So if these people are not available, it should be from any government official authorized by law. Okay, so these interment requirements, so these interment, so meaning it's the dead body is being gotten out. So exhumation, the other term is exhumation. So who died of non-dangerous communicable diseases for how long? 3 years. Non-dangerous communicable. How about if this person died of dangerous communicable diseases? Think about like 5 years. So if it's communicable, then it has to be there, but it will take a longer time compared to this one. Para to allow those bad bacteria to move out of that place. Diba? Okay, so for the licensing and registration procedures, so mga embalmers will do so. So here are this. I'm sorry, this is supposed to be here. So any person who desires to practice or undertaken or embalming shall be licensed to practice only after passing an examination. So yeah, they are registered. They want it, they can do that. So aside from that, these people, it's not here. They're exemptions, so government and private physicians may perform embalming without license. Okay? So as doctors, we can actually do that, even without license. Pwede rata. And registration certificates as exigencies required. So, buta lang na sa imo appointment na as to the exigency of service, doctor, so and so, can actually do the process. So, pwede din po tayo mga embalmer. Diba? So let's talk about autopsy in this section. So there are persons authorized to perform, so health officers, medical officers of law enforcement agencies like sa PNP or NBI, members of the medical staff of accredited hospital. So most likely, like mga government hospital with particular trainings in pathology, they are usually the one who would be doing autopsy. So if there is no particular training for pathology, it would be very difficult for that particular hospital. So it has to be performed when the permission is granted or no objection is raised to such autopsy within 48 hours after death. So if there are questions like, we will never know, there are so many factors that they still have to be cleared, so much so that the dead body can be held sa So, let's talk about autopsy. No? So, prior to our dinner, so this is describing the procedure and it's taken from the origin of the word is a quick of origin. Autopsia means to see for oneself, autos oneself, and opsis I, so to see for yourself. But I tell you, it's not done that way and you just immediately open it. Of course, we have to follow some procedures. So, what are actually the purposes of doing autopsy? So, of course, we would like to know the cause of death. So, oftentimes when an autopsy is done, it's usually in the interest of this person to actually know what caused the death of this person. Then, in clinical medicine, it could be of great help, as in it can actually improve the management of this patient, specifically if there were some errors. No, you can find it out there. The person is already dead. There has been so many studies that suggested that 1/3 of death certificates are incorrect. Imagine, and half of the autopsies performed with those findings that were not suspected before the person died. Like, they would just, we usually use the term, kung say imong i-out, imong sign out to this patient, pneumonia, severe pneumonia. No, it's not at all times, it's not, I would be then expecting you will be able to do that it's not cardiorespiratory arrest. Inyong ibutan should be written on the immediate cause. Okay? And then, surprisingly, 1/5 of unexpected findings can only be diagnosed histologically. What na? The death certificate is already out. Okay, so this is what I've been telling you, forensic or coroner's autopsy. So this is the one which is being prescribed by law. And this one is what we call as the voluntary one, wherein it requires the consent of the king. Okay pa mo? Okay, so when you open the body, there should be a description of ethnicity, sex, age, just like any other thing. Know that you are to write in there. Then you would have these options whether to have a recorder or you would just do standard examination form. Because just have to record it. In some other countries, they only use the external examination and they call it as view and grant. And they don't have to do some internal examination. Okay, so this is how it would look like when doing internal examination in the case of autopsy. So you have to have a plastic or rubber grip, or what we call as the body flap that is placed under the back of the body. It's here, so to allow the body to be like that, the hands would be, and the arms would be outstretched. And then it would be easier for the investigator or the doctor to see or to inspect the internal organs. So the first one is being open. open already or bisagana pa, is to inspect for evidences of trauma or some indications which could probably is the reason for the death of this patient. And there are approaches. So we can have the deep Y, or they call it as modified Y. We also have the T. It's here. Single vertical cut. So this one here, this one Y, meaning Y, this is usually helpful in terms of like strangulation. They're looking for that. Then, so single vertical cut, like if they are to look into the structures of this part, and usual one, this Y and the T shape, and they can actually have a combination. So after which, there could be this one. So they will try to open any area sa ribs. Okay, there are actually 4 known approaches bearing the name of those who discovered it. We have the Gone method, you know the person. So, this is what we also call as the en bloc or organ block method. So, it actually involves removing the organs in 3 separate blocks. No? So, in contrast to the other method na one at a time. So, kani siya organs in 3 separate blocks. So, we also have Rokitansky method. So, they are being dissected in situ and removed en masse or as a block. So, we try to compare with this one. This method actually preserves the anatomical relationship between organs. Okay, sometimes it could be difficult for the investigator na the orientation of these organs, okay, the heart is already there, the lungs is there, the stomach, okay, while you're doing the procedure. Anyway, so after that, when you're done with whatever approaches that you are, the approach that you're using, it has to be reconstituted. So you will report, do not leave the body like that na, and then the internal organs are out. So you are removing all internal organs and then you leave them like that. So you have to return them or it wouldn't be that hurting on the part of the family members looking at their deceased loved one na bungkag na ang organs, they are not in proper order. Okay, so I know you don't like that much we talk about history, but we have to do this. So as to the history of autopsy, so it was in early 3rd millennium BC when people were thinking about like disfigurement of dead persons would actually prevent them on entering the afterlife. So they are trying to blame someone else for that. So there were some people who made themselves showing on the list of people in the history, you know. So if you can still remember the murder of Julius Caesar, so it was actually the subject of official autopsy. It was very clear, no, it was very good enough to explain what actually killed him. And there were some dissection already which are being done after that. And as to the modernization of the process of doing autopsy. So we have Giovanni Morgagni, of whom he was being celebrated as the father of anatomical pathology. There are also other people whose names are also being used on the particular methods which are being used in autopsy. So, we already have talked about this, the external examination, the internal, and the approaches. So, Marto, reconstitution of the body. So, I don't know if there are British citizens here It was in UK where they have this Human Tissue Act of 2004. So if you are doing the autopsy, you really have to return the organs to the body. So is it applicable in the Philippines? No, it's not applicable in the Philippines. But we have this Human Organ Donation Act, and it's being described there. So same term, Corona. You have to return the organs to the body. Okay, so we have to move a bit faster now. Let's talk about causes of death. So I'm showing you the 10 leading causes of death. So in the Philippines and the whole world, 2004 and 2016, still diseases of the heart. Have you had those thoughts now? Why is the heart the major cause of death? Anong heart man yun? It's very traitor. Anong heart man yun? Okay. I'm sorry, I really have to interrupt with those dramas in your mind. But on my perspective, no, I do believe it's like that. Because majority of our death certificate would have the immediate cause of death, cardiorespiratory arrest or cardiac arrest. Diba? So it will be counted as to the heart diseases. But anyway, it's still very common. So we have some of the things that you don't like that much. So we have RA 3753, Civil Registry Law, which requires the continuous, permanent, compulsory, and universal recording of vital events. So what are these vital events? When someone is born, someone is dead, you're getting married, you are separated, you are to have your kids, they are to be registered. So that is what is meant by RA 3753. And there is another RA, which is 10625. It's mandating the PSA to do that. So what type of hands? So if you can see this, as to the birth registration, there were 93% compared with death registration, 66%. So if we are just to look into that, we could probably say now there are more children being born than people die who are dead. But it's actually probably correct, partially correct, but it's because not all deaths are being recorded compared to when there's already a new family member or katat mo kita magpa-register, and compared to that of death. How about those, sorry I have to mention this, how about those katong mga sabongeros who are still missing? Are they recorded already? For sure, not yet. How many are they? Was it known? Is it accurate? We don't really know, no? So, the death registration coverage is only 33%. And it is said that there are only 2 out of 3 Filipinos who die at home are not medically attended. There are those people who died na they are not being attended by physicians. So there are common problems when we deal with the registration of dead people. Some of these are being stated here, like details which are being incomplete. Even mga fractures, not very common, no laterality. Some doctors would just write there, closed fracture thigh. It's not being mentioned if it's right or left. Diba? Well, it's very important. So these are some of the figures. And take a look at that 61% deaths attended to by a doctor. So to help the doctors come up with a better diagnosis, uniform perhaps, we have the ICD-10. So this is International Classification of Diseases. We actually have ICD-11 this time, not 11. But we're still using ICD-10. For example, just talk about diseases of the children, no, like pediatric community-acquired pneumonia C, so it's J18. So there are codes like that. So if you're going to use that one, so it will be uniform. And it will also be easier for the PhilHealth if it's billable or it's being covered. So on mortality statistics, it can also be standardized. So if we are to use this particular code, similar, I would just like to share you're familiar with hand, foot, and mouth disease, right? But do you know that you cannot really admit a person, or probably you can admit sick child with that as hand, foot, and mouth disease. Why? It cannot be covered by PhilHealth if you use that term. So it has to be, let me remember, enteroviral vesicular disease with exanthem. It would be like that. So not really hand, foot, and mouth disease. It's a very different name. But if you're going to use that one, there is a certain ICD code which will validate it, and then it will be covered by PhilHealth. So it's very important. So what are the mandates of the DOH? So there is a certain circular of the causes of death now, and even a memorandum on filling out the time intervals and there is a certain circular, and this is new. So I've been teaching this one since last year. Okay, it has just been incorporated into our curriculum that we are going to do this one. So think about that a physician who would be filling out the death certificate is attesting to the best of his knowledge. Imagine that's a legal document. So the name, if you can see it there are only several parts of the medical certificate for a doctor to fill out. Not really everything. I have to warn you na lang sa previous batch, they killed their classmates. They wrote the name of their classmates when I didn't ask them. Okay, so warning, do not kill your classmates, ha? Okay, so for the Civil Code of the Philippines, Article 412, it has to be correct and complete before registration. So, death in an ambulance. If I have heard about those people, those sick people, probably sick or not, or just had an accident and they are being carried by the ambulance and they died there. So who will be the certifier of death? So it has to be the last attending physician during the patient's transport. So how about if it's not being attended to? Ikuha lang sa ambulance going to that particular area. So if it's going to that hospital, the administrator of the receiving hospital, muna siya. The patient will be there. The doctor has no idea what actually happened to this patient or what actually killed the patient. So how about for DOA? Who are the certifiers? ER doctors. Okay, so how are they going to make it possible? Through verbal autopsy. We're joke, no, pero I have experienced this with a certain doctor who is definitely our graduate. Yeah, he had his duty in Garcia Memorial. And when you are junior consultant or you are consultant, any time of the day, you will be called. So he tried to ask me, Doc, I do not know about this patient. How do I fill out the death certificate? So because I was traveling, I told him verbal autopsy. He cannot hear me actually, so I just texted him verbal autopsy. Nabalik na lang ko sa hospital. I was already there, I was back, but then they are not yet done doing the verbal autopsy. Why? Because they don't know, according to the nurses, they don't know what to prepare, what particular instruments they are going to prepare in doing the verbal autopsy. Okay, let me just be clear this with you. Do you have any idea of what I'm talking about verbal autopsy? Okay. Okay, you will know later. So for DOA cases, it needs verbal autopsy. So let me just continue. How about deaths in moving conveyances? For example, shipwreck, mga kana, who are the certifiers of death. So if, for example, a certain, ano siya ba, vessel, tungod sa talisay, so it should be the MHO of talisay who has to certify death. Dili ang captain sa boat or sa airplane. It's not the pilot who would certify the death, but they are the reporters. They can actually report, but not certify death. Clear, ah? How about in mass casualty incidents where body is not identified? Certifier, local health nagyago, still the MHO, but who are allowed to report? Nearest kin or person with knowledge. Government officials can actually do that if they are the nearest kin or they know, they have the knowledge of such. So for reporting requirements on which it is involving vehicular crashes, so it has to be indicated whether the deceased was the driver, the passenger, or pedestrian. If you have heard of the accident that there were two girls riding on a motorcycle and another young man, they really have to ask if the deceased is the driver. So it's very much needed. Not only for marites things, no, it's very much needed. Siya by passenger or the driver, and including the type of vehicle, it has to be noted. So now let's talk about the death certificate. Okay, I would like to give this question to you. Which of the following are not true of the death certificate? Is it legal document necessary for the burial of death? You say yes, it is true? Yes. Certifies the occurrence of death? Yes. Conclusive evidence only as to the fact of death of the deceased? The diagnosis of the death certificate is not conclusive evidence as to the cause of death. Yes. Okay, so what's your answer? I guess like the no on C and D, and they are giving me the answer na E. It's okay, right? Yeah, you are correct. You take note of that. Who cares? Who knows? It will come back. Probably fist death or strain. Basta nangapag na ko. Okay. So for the death certificate, kasi 6 ng pasar. So the death certificate contains the following. So it's not only limited to this which are being mentioned. So napapod mga address. So these are just the very important things. Why? Because when we have the death certificate, it's already being filled out partly. Can I name? It's I actually wrote some. I wrote from the hospital. So as not to waste the hospital resources, we only wrote. Okay, I will be sharing this to you. So on the first part there is what we call as prepared by. So the prepared by signatory would usually do the filling out. But those parts like on the medical certificate part mismo, on the 19B of which you shall see that it has to be filled out by the doctor. So for the cause of death, so that's what killed the person, right? So we have the immediate or the primary cause, and we also have under this the other classification. But when we talk about immediate, not on the legal part, that there are only two classifications. So we have the immediate, the underlying, and the antecedent causes of death. So, immediate, what actually caused the demise of the person immediately. Not giving time, like years back. Okay. So, but the most important one here is the underlying cause of death. So it is the most important entry of the death certificate. Wherein for census, they are to look into. So whatever you wrote there, if there's nothing else written, then they are assuming that that is the underlying cause. Okay? So if you really don't know what to write there sa antecedent and immediate, you don't know, or you wrote immediate but no underlying, then it's automatically be recorded under underlying cause. Clara? So this is also the basis for the preventive public health, wherein like they were thinking na, heart disease, so we have to make some programs as prevention for this. There is also what we call as the antecedent. So this is what is like other intervening causes of death. Pwede nga not more of directly caused the death. It actually couldn't be filled out. Pwede lang siya dili, but you really have to have the underlying cause. Okay, there are other diseases which are not directly causing the death of the person, but then it could give like it could affect significantly the person. Let me give you, for example, a person is brought to the hospital for shortness of breath, but this person is also a diabetic patient. So later, more shortness of breath, and the person died. So pwedeng the person actually died of respiratory failure. And this person could probably have pneumonia. Di ba pwede? Uy, are you with me? So the underlying cause of the hypothetical person that I'm talking about is pneumonia. Di ba? And the immediate cause is respiratory failure. And we could have other significant conditions like diabetes. It's not actually the one which immediately caused the death of the person. So as I've been telling you, another one which is a legal cause of death is what we call as the secondary cause of death, or the proximate cause. It's very important to look into the intervals. It could be seconds or minutes or hours. You can use that one, and you look into this. As usually, the underlying cause of death is the first one which you work. Think about that. Antecedent, pwede in between, immediate, underlying, or it is not part of that at all. In the immediate, it is the last condition that directly resulted to the death of the person. So considering this one, as to the interval, of course, the shortest interval is the immediate cause, di ba? Brad, 35% na. How about the term, using the term probably, in as much as possible, do not use this term. For example, acute respiratory failure, probably secondary to pneumonia. Why? So, in terms of legality, the doctor or this particular description will really, what we call as, will fall short. Diba? What is needed specifically in criminal cases, there should be proof beyond reasonable doubt. So how can you do that if there is probably pneumonia, probably diabetes? Then the lawyer will just ask you, unsa man jud lo? Diba? We should be firm. So, there are what we call as mechanistic terminal events. So, like cardiopulmonary arrest, which is very common. As much as possible, we don't use this one. We really have to analyze our patients. lying, there would be like, think about those, I hope I'm not hitting the wrong nerve, chronic alcoholic. So, we could probably say liver failure secondary to chronic alcoholism, for example. So, you really have to attribute it to a certain cause which is long been there. So if it's there, so that will become the underlying cause. Then another one, the entries at times could be very incomplete. For example, abscess. Where is that particular abscess located in the body? Ulo ba? Das lubot or das kamot? Then, how about if the abscess is brain abscess? And then the patient arrived in coma, so it can be related. Pero if the abscess is nasa at the buttocks, the patient is now comatose, it's very difficult to associate. So we have to check the correctness of our entries. So if you do not know anything, there were some doctors who would really write, you cannot do that, you write OJK, only God knows. No, you really have to think about that. And then on the part of the interval, there was OTCT. What is this OTCT? The immediate cause is OGK, so only God knows. And OTCT, time interval, only time can tell. Hindi na siya pwede, ha? It should have an entry. So, another is, there's only one line and you are writing a lot. So, hindi ko na siya pwede. Now, let's talk about the manner of death. So, the manner in simpler terms could be natural or violent. So, when we say natural, so it is caused by natural disease or any condition of the body. When we say it's violent, so it can be brought about by certain crimes like homicide, murder, or we can even use suicide. So the mechanism of death is also part of that. So it can be also a biochemical disturbance which is incompatible with life. So like nowadays there are so many cases derived from the use of illicit drugs, and they can actually evoke some presentations which would be very difficult for the physician to analyze. Okay, we recently had a case of 22-year-old male marathoner na while doing the running, he just collapsed. No, he was not able to finish it. He collapsed and he was brought to the hospital. And when we were trying to look into his vitals and as well as the monitoring, malibog jud ka, you would be having trouble analyzing. It looks very different. It's not following the usual pathophysiology of any diseases. And then later, the patient actually arrested like 3 times, and we were able to revive him. So it's very confusing. No, somebody siya and he's only that young. But later, when he was already in a state of mga 8 na GCS 8, so more or less going to the coma state, there had been so many issues like this person has been on illicit drugs. So so the usual na mga instantaneous na mga death were usually brought about by the use of drugs. Okay, I hope you're familiar with this. Can you tell me 2 words which is being described? What's the second word? I'm sure you know Lazarus. Yeah, but Lazarus. You know this guy, is the, if not the latest, basta recent one na he had the Lazarus syndrome, but he died mga 5 days later. Okay, let's talk about that. This is a new one. It's not of the old school, no? So, let me just simplify it as the spontaneous return of everything, nullified, and then able to live normal, ayun yun. Okay, so I would just like to clarify this with you. This is a rare setting. Dili siya common, and accordingly, it is not well understood. There were some theories that when we try to revive or resuscitate a person who arrested, and di ba we're giving like epinephrines, mga other drugs, di ba? Fluids we're giving, there will be, the first theory is that there will be a lag na which will allow some time for it to effect down. That's why when the doctor already pronounced this person dead, his body is trying to process those chemicals which are taking their actions into the body late. And another is they are also thinking in some other theories, but of not that can I give it in space planning. They're also thinking no people. Then they're thinking like it's just spontaneously returned. It just the body just had a longer time recovering, but it actually did. So in comparison with the Lazarus reflex, with the Lazarus syndrome, they are two different things. I think Lazarus reflex actually is a presentation of someone who is, should I say, actually dead because yeah. And if you look into that, it could be mistaken this person is still alive. Okay, there is a spontaneous movement, but it's actually a reflex. Specifically, when there are brain dead, but their spinal cord is still functioning. So both may reflex. So oftentimes they could move their body just like that for a while, and they would even slap their face or the chest because the spinal cord is still intact. But actually the person is already brain dead. So compared to Lazarus syndrome, it's a complete reversal of the situation. So, if you want to know about that, there are so many cases. I'm just giving you 3 cases. This is for your own consumption. Okay. So, the degree of certainty to the cause of death. So, how would you know that this person is actually dead? So, it's beyond reasonable doubt. If you look into a situation which could actually qualify. Hindi naman siguro na siya questionable na this person is already dead, unresponsive. The probability like being electrocuted, yeah, given that so wala na yun, can you still think that this person is still alive? Or you have known that this person has been into a certain irreversible drug reaction, or even some conditions which couldn't be explained that well, like mga instantaneous death, mga pre-death. They really cannot be explained na our minds could really comprehend na like this baby is already dead and we couldn't explain it. Like this one, so I'm talking about that one, sudden infant death syndrome. So apparently well, the baby, but then when you check on the baby, it's just dead. So how would your death certificate look like when you are to fill it out? Then in cases of the adults, we also have this SUNT, diba? They just sleep, and then that was their exit. Okay, I've been talking about the DOA, and it's not a very good practice for us doctors now. We have to write there OGK. Okay, we do not know. So if at that moment we still don't know, you could write like undetermined. Then you just have to write DOA. DOA is not a diagnosis. Okay, now so since I've been talking about that, so here is what we call as verbal autopsy. So it is simply talking with the people who have the knowledge of the deceased. Okay, for example, the family members If there is a certain case of DOA, this person is really dead naman, no? Then you ask for the family members, who are those people living with this patient, a dead patient. Then you ask, nabali siya sakit, is he diabetic, hypertensive, is he on maintenance, has he been admitted to the hospital for whatever reasons, vices, or what actually happened before this. So that is verbal autopsy. So we should be extra careful when we try to ask it. We do it with compassion and empathy, while we are actually wanting the information that we want. So the principle behind that one is that we as physicians are smart enough to have this correct interpretation out of those data, convert them into information. Okay, let's find out. So let me read this first case. Okay, I'll be giving this to you. These are 17 copies, so one for each SGD. Do not write yet ha. We rin sa ninyo. Basta for all SGD. So, because we don't have the luxury of time, we'll try to answer this one. Okay. You read along with me. A 56-year-old person died from abscess of the lung, noted 5 days before death, which resulted from lower pneumonia of the left lung due to strep infection, which was diagnosed 2 weeks ago. And this person also had a history of ETP. Okay, so can you tell me without facts, what is your immediate cause? What actually caused the demise of this person? Lung abscess? If di ba abscess, you really have to take the lateral lead. Is it left or right? Here, we have right and left lung. Okay, left. It's taken there now. So what is your, do you have an antecedent cause? Yes, it's mentioned, di ba? So before that, what was in that patient which survived for so long already? It's PTB. Di ba clear, Roman? Say it, Roman. How are you doing? How about people at the back? Okay, ra? So it's also stated there na 5 days. So after 5 days, so this actually killed the patient. But mas nakapag-kill po niya is we have an antecedent cause which is brought about by strep pneumonia. So the pneumonia is here. And had it not of his TB nga years na, probably he is not that vulnerable, right? Okay, so that's for an adult. And cutting it short, let's talk about fetal death. So if it's a fetus that we're talking about, you look into sa front, diba, for adult. On the other side, there is a space there for 0 to 7 days old. So, when we define fetal death, it's a death prior to the complete expulsion or extraction of the fetus from its mother, regardless of the duration of pregnancy. Okay, diba? When it's like 20 weeks or less, it's abortion, diba? So there are terms. So, regardless of the duration of pregnancy, basta like ikuha or nakuha siya, that's fetal death. Okay, so it has been said that a fetus less than 7 months and dies within 24 hours after delivery is not being born. Okay, you look at the back page of your paper, it's different, no? Okay, for infants, with ages 0 to 7 days, the usual mode of dying would be asphyxia, or there could be heart failure, which is already evident at the time of birth. Like, pag cyanosis na siya daan, there would be desaturation. I just want to clarify, are you still with me? Cyanosis, bluish discoloration, desaturation, oxygen saturation, which is, okay, what is the normal? 100% or at least 99. So method desaturation is below that, like below like 94, 93, 92. How much more if it's 80? Wala, intubate na. Okay, so kung na siya ha, tulad na roon. So for fetal death, so it looks like that. Please look at the paper that you're holding. It would be like that. So you really have to fill them out. Getting a part here, the age of the mother. So if it's mentioned, you answer it's mentioned, and this one. So more importantly, if those things are not being stated, it comes out, particularly by time for our exam, it comes out. So you just have to look into this unless you're being directed to fill out the same. Okay, so for infants 0 to 7 days old, they are in the unique, so you just have to write their conditions. So main maternal condition or diseases of the mother, that's the part there that you have to write, like maternal UTI. The rest is for the infant. Okay, the causes of fetal death. Then you will also answer on 20 if the is it before labor or during labor, or it's not really known. Okay, just saw the fetus and it's dead already. The attendant is the doctor, the midwife, or it's okay, so you have a clue there on how to do that. I hope you will be reading that as you go home or go to your respective dwelling places. Now let's try to analyze this one. Okay, you are reading along with me, 38-year-old Gravida 3, Para 2, 2002 mother. Wait. Gravida means, wala ko man may okay, no? Gravida, gravidity means for how many times has this patient been pregnant? Okay, so for the third time pregnant, P, parity, so siya 2 children, and 2, that is abbreviated as TIPA, so the term, the 2 of the children are term, P, preterm, abortion na, and there are 2 living children. Gets na? On her 34th week of gestation, so what is the normal age of gestation for an infant or for a fetus to be born na term? Ang pisigabot ninyong ubi, nanamoy kini, napapagdi ako. So the full term is 40 weeks. But if you use the 37, it's term. Term na 37, but we cannot use a full term. The full term is 40. Okay. So after 6 hours, she delivered a stillborn baby boy with his umbilical cord wrapped around his neck. So there is cord coiling. So the fetus was cyanotic, so balik na sa cyanotic, can you imagine that? With no gross fetal movement nor heartbeat. We really look into that, diba? We are to score GAR. Diba? So a baby with an upper score of 8, 9, if not 9, 10 is a baby with a good cry. With good cry and activity. If no movement, so limp pa, cyanotic pa. Okay, can you now tell me, if you look into your forms at the back, so what is the main disease or condition of the fetus here? also wanted. What else do you see? Imagine yourself if you are being wrapped with your own umbilical cord. A joke, but doctors we don't use the word joking now. We use the term asphyxia. Okay. So what else? Prematurity. So which among those we have mentioned, you're going to write there as the main disease. So more of a shock, the immediate cause. A baby with no heartbeat is dead. But imagine a child cyanotic with poor activity. So work 1 a.m. verse 4, 1, 3, nga na. Nilumat. Cord boiling, what else? Asphyxia, prematurity, and how about support sa mother? What is the main maternal disease or condition? Can you see any maternal condition? Any problem with the mother? You did not see it? Wow, uy. Yes, because I'll say that. There's a preterm labor. Okay. Okay, I don't have to make it that difficult to you, no? So, how are you doing? Correct, can you answer? In chronological order? Okay, but you also have to know there that like fetus died before labor, during labor, and then the length of pregnancy was also mentioned, like it's 34 weeks. So 34 weeks is preterm. So 37 to 40, up to 42, that's term. Early being extended like more than 42 weeks, that's post-term. Okay, right? Okay, you can read that when you go home and please analyze. Okay, or we can increase our other color in output. So how about the death of women in childbearing age? So di na siya fita, that's maternal death. While pregnant, okay, death of a woman when you're not pregnant, so that's lahipon. So, pero pwede a pregnant woman could die from other causes, like na COVID, pregnant pero the pregnancy did not kill her, it's the COVID. That's possible, di ba? But we have to take into consideration all those diagnoses and condition. Okay, what actually killed lang. Okay, for women in childbearing age, we really have to look into these things. So many things. Like if the patient is pregnant and hypertensive and still with other infections like UTI and asthmatic, problema tayo. Okay, let's check this one. 36-year-old, Bravida 5, Par 5, 3114. So, kanina na may 1. There is one preterm child, and she also had 1 abortion, and there are 4 living children. Delivered a full-term baby boy at home, was brought to the emergency room because of an hour of severe bleeding. She was hypotensive on her arrival at the ER. Whole blood transfusion and manual extraction of placenta were performed. So, di ba, the placenta would come out spontaneously, but there are times wherein the doctor has to extract it manually. So, it also should be indicated that there was manual extraction of the placenta. However, she died 4 hours after placental delivery. So what actually killed this woman? severe bleeding is which part? Is it the antecedent, underlying, or the immediate cause? And bleeding? Okay, you have to imagine the story ba kung sa una nahitabo, what actually took place, what happens first. Diba, what happened last is the immediate cause. So, kung sa una, what actually this patient delivered, and then there was a retained placenta. When a placenta is retained, there is a higher probability of this patient to go into bleeding. Huwag ito nakuha ko, okay, para we can avoid bleeding. So, naguna, placenta reduction. Retained placenta in singular term. And because of the retained placenta, there is bleeding. And then, because of that bleeding, the patient is going into, I hear it, shock. Going into shock. What type of shock? Grabe na siya cardiogenic shock or septic shock. We can only say septic shock when we are talking about infection, mga microbes. So, hypovolemic shock. So, what is now your immediate cause? Hypovolemic shock, which took place like 4 hours after placental delivery. So, okay, so how about the retained placenta? What is the interval? So 4 hours po siya ng hypovolemic shock. It should be longer than that. Di ba? Probably developed for point something or 5 or more. How about the bleeding? Sometimes we really have to imagine that one. Okay, even for you, they happen at the same time, 4 hours. Yes, you can probably add 1 hour, right? Oh, that's how it will look like. Claro, maybe you can practice at home. I gave you that one. You can have a photocopy or you do it in our separate papers. Sige. Okay. So we have the fetus, we have the mother, the adult. Now we'll have the elderly. So for elderly, we cannot just immediately write in the death certificate na what we call in Bisaya na sa katiguangon. No, that's a violence on the part of the elderly. We think about other causes, no? Do not just use the term possibility. Or if you really do not know, you can actually write undetermined natural cause. Like, she was just sleeping, but that was it. Okay. However, if you could see some inconspicuous injuries, mga so makita ninyo which could tell you that you could be doubtful that it is actually natural kasi abuse me. Think about that. Or was there any suicide letter before this elderly went into sleep? Di ba kasi nag-suicide siya before siya to. She took like overdose of her medications, for example. So we look into that. So we may use undetermined natural cause. We really have to rule out foul play or other apparent injuries. So we can otherwise consider these other causes like sepsis. It's very common. Pero sepsis, we need to have a CBC. The patient has to have fever. The qualification, you have this. Pneumonia, you have jet lag, diba? Sepsis, septic shock. So pneumonia and Nicotinus ulcer. Try to look into the body of the patient. So for the underlying cause, it can also be physical or chemical in nature, like that would cause the trauma, like na-slightly in fracture, yeah, also bedridden na, and Nicotinus ulcers. And since there is less movement of the body, so the patient had pneumonia. Pneumonia na nagkapatay. than just simply writing their old age, died of old age. Okay, so another is death involving external event. So what is external event? Think about other things which is not naturally driven. For example, accidents. Okay, let me give you this 24-year-old male brought to the ER, unconscious, the BP is 80/40. Something 80/40, hypotensive, heart rate 52, bradycardia, threatening with pulses, in short, dying. There was a note of bleeding from his forehead 30 minutes prior to the consult. Witness reported that the patient had an altercation with friends during party. So you also have to note that where gunshots were heard. He expired about an hour after the accident, despite resuscitative efforts. Sige, tell me what is your immediate cause? So pag-shot, patay na yun. So he shot, nag-bleed, and then, what happened? Sorry for the reaction. First, ipusil, nagdugo, namatay. Okay, so how do you write it there? How do you fill it out when it's ipusil? Which took place about an hour. Okay. It's pretty na siyang sunod-sunod. Like, the antecedent could be very close to the underlying. Yeah. If siya gamay, it could be, interval could be way lesser kung immediate. Shot, bleed, and so what actually killed the patient? What is the immediate cause? Loss of consciousness. The patient forgot to breathe. Brain damage. We are doctors, man. Brain shock, cerebral depression, hemorrhage sa brain. Sige, Okay, so we don't write there gunshot. If it's the description of the wound, you write gunshot wound. But as to the cause of death, you write firearm discharge. Mas we use the proper terms kay dili pa jud ka claim, namatay na gali, pero ka claim sa PhilHealth kay gunshot wounds niya, not so fatal in the description. Ganong namatay, naigo sa kumingking. Anyway, previous cerebral gunshot injury, which should actually lead to massive bleeding. Then, because of the impact and which is happening in the brain, there will be brainstem herniation. You still remember the parts of your brain? Okay, so as to the brainstem, di ba? We have medulla, pons. So where are they particularly located in our body? So of course it's in our brain. It's inside our skull. So it's in close proximity to our foramen. So you know, sa oras balik. Hindi mo herniate, it should be foramen magnum. So if it herniates there, so what is in there? What are there? What particular structures are there? Respiratory center, BP, heart rate. So the patient who is the victim would eventually, of course, die eh. Close naman, and we switch off centers. Okay, so if this is death by external causes, the manner of death, would you really write there, homicide? You were not there, diba? And if you write there homicide, or murder na patay ka, you will be the suspect. Okay? You were able to write it there. So for your own safety, right there, no. Do not include that one here. Also, any accidents, vehicular accident, you can actually write accident, but do not write homicide, suicide. Very sure so you are the perpetrator. So the place of the occurrence of external cause, you just have to write unspecified because you were not there, you don't know. Lisod kaayo. Okay? So, for the details in reporting external injuries, it's like this. Ana siya kaputi. What particular area? Kunya, like, you are not studying well in your anatomy, in your surgery, the particular area. What type? What is this? What is this area? Okay, so as I've been telling you, we have ICT terms which will help us make our lives simpler, no? Like, instead of these ones, we're going to use the other terms which is being assigned certain ICT codes. Okay, if it's from infection, you really have to write the causative agent if it's known. So, you may write probably. It's infection, like, you don't have the luxury of time to do that, and the patient eventually died. No question on that. But if it's a very clear case, like in the case of COVID-19, you really have to do that. Like, this one. So it requires an official confirmatory test. So if it's confirmed, you have to write there on the underlying cause, COVID-19 laboratory confirmed. So how about those who died of COVID-19 and then they were not confirmed, they died already? Non-laboratory confirmed. You just write probable COVID-19. Okay, some people are thinking that we make money out of this. Now we diagnose COVID-19 as easy as that. So if you're suspecting COVID-19, we just have to place the patient away from the other patients with infectious diseases also. So we have to isolate the patient, and you would say probable or to consider COVID-19. If it's ready to sign out, you can use probable COVID-19 kung you were not able to catch the time that the patient died already without confirmation. So, ano na? Okay, so how about the patient already died with pending laboratory result and they are asking for the death certificate, and even malubog, the patient, the victim or the patient cannot be, there could be no burial, okay, wala death certificate. It's required. So you have to really issue a death certificate. So you just have to write on the underlying cause area, suspect COVID-19, not laboratory confirmed. Because we are very suspicious. Okay, it really requires confirmation from the laboratory. So how about maternal death, but with some circumstances which are aggravated by COVID-19. So, not just COVID-19, you have to write pregnancy complicated by COVID-19. It doesn't need to be stated like by COVID-19, by unconfirmed COVID-19. Really na, it's fine, you have that. Okay, so other deaths like COVID-19 pero did not die of COVID but died of other conditions like in an accident. Like this one, subarachnoid hemorrhage because of a blunt trauma to the head. And what is the underlying cause? Car passenger. So car passenger in collision with truck. So moto yung underlying cause. So you can use that one. So for the reporting, it will be like that, but you also have to write in there sa other significant medical conditions, COVID-19. Okay? So similarly with other conditions, healthcare related, but we should be very careful. We do not write hospital-acquired pneumonia immediately. How much more if you say nosocomial infection? Patay. Usahay, we just have to write community-acquired pneumonia or aspiration pneumonia to avoid some issues. Okay. Okay, we just keep that piece of paper. So for our exam this Monday, the coverage will be this topic. By the way, for the references, I wouldn't ask you anything which is not here. Probably you cannot see it on the slides, but I merely said it. Any questions? None? Understood? Yeah, score? Okay, you proved to me the last issue was just about time.
This time.
Okay, the number of items will still be 25 items. Sige, how much do we have that? 15 will be MCQ, and the remaining 10 will be the filling out of that death certificate. You don't know, it's just the name of the patient, number 2, the address. I already submitted it. Any more questions? Imamutan na, anything to come? Imamutan na yan. Clear, understood. Clear as much. The last one, basta I'm expecting you to have a higher score. By the way, I'll be returning your there were really some of you who were not following instructions. Anyway, I'll be returning all your particulars tomorrow. I'm just telling you here. Okay. I have decided na lang to write your scores on your particular. Para you don't have to fall in line. Underline cause, fall. Immediate cause, not reading. Any more question? Okay, requesting anybody?